This is my coding presentation for the HIT 215 assignment. I threw everything into PowerPoint and I am going to try to move pretty quickly, I think. So diving right in, we have the case history here. 87-year-old white male who has coronary artery disease and morbid obesity. He recently had a kidney stone removed. He claims that his only symptom of the stone was persistent back pain. Since the surgery, he has been doing fairly well. We were given the diagnosis to code for this particular case. And starting at the top, disease, artery, coronary, I25.10. The encoder codes to morbid obesity for exogenous E66.01. Degenerative joint disease involving multiple joints. Again, the encoder requires osteoarthritis generalized for multiple joints, M15.9. History of congestive heart failure for a code of 150.9, I50.9. Atrial fibrillation, I48.91. And then history of myocardial infarction, myo healed, I25.2. The next case, we are given gait disorder with central peripheral components in the context of cervical spondylosis and peripheral neuropathy. Gait disorder, and in the documentation is noted as ataxic. So going to the encoder, we go to gait, ataxic, and we get the code R26.0. We move on to spondylosis without myelopathy or radiculopathy. And then we are in the cervical region and we get the code M47.812. And then peripheral neuropathy falls under neuropathic in the encoder G62.9, just to make sure I got that all correct there. For case 3, we were given the diagnosis to code for the case, starting with hyperlipidemia, E78.5, coronary artery disease, I25.10, cerebrovascular disease, and you don't want to stop at cerebro like I did. You want to continue onwards with cerebrovascular and get the code I67.9. Esophageal reflux, for the code of K21.9. And then anxiety with depression, F for 1.8. And that completes that case. For case 4, we are presented with the history of present illness. The patient is an 88-year-old veteran with chronic constipation, mild dementia, and positive PPD test with negative X-ray. He complains of soreness around the anal region and incontinence of stool and sometimes urine. The patient is alert and well-oriented today. Vital signs, as per the nursing staff: chest clear, heart normal sinus rhythm, abdomen soft and benign, rectal The anal area and surrounding perianal area is erythematous, and there's a tear going from the rectum to the anal region. Slight oozing of blood was noted. Rectal exam was done, and I could not feel any masses in the rectum. However, the exam was painful for the patient. Anal tear with hemorrhoids. And we see tear, but the encoder utilizes laceration. When we click on this, we notice the red text, and we need to make sure to include all parts of the code, including the character for the initial encounter. So the total code is S31.831A, and then hemorrhoids in the documentation is not specified. So K64.9 is the total code for this case. Case 5, we also have two pieces of information that are fully described in the documentation. Orbital pain, right hip pain, rule out trochanteric bursitis. Orbital in this encoder is also ocular. We start with pain, ocular, and then we receive the partial code from the index H57.1-. We click on this, and to describe the laterality, we're going to go down to ocular pain, right eye, and we get the code H57.11. Right hip pain is the second code to diagnose, or second diagnosis to code. We're going to go pain, joint, hip, and again, we're given the partial code of M25.55-, and we go and we look for the correct laterality is pain in the right hip, M25.551. And that completes that case. For case 6, the assignment mentioned that 6, 9, and 10, I think 6, 9, and 10, or 6, 8, and 10 also use E&M codes and CPT codes. To start with, we are given the ICD-10 diagnosis 2 code. We will start with mononucleosis, B27.90. We move on to pharyngitis, and we are given J02.9. Then we have otitis media, and in the index they give us the partial code of H66.9-, and we have to find the correct laterality, which would be H66.93, bilateral, both ears. The evaluation code, we move over to the CPT finder, and we do have the information here for patient, so I'm going to go ahead and throw that in, and we're going to use HCPCS CPT finder. We are going to read the documentation saying that she was referred to me by her primary care provider for further evaluation and medical treatment. This is a consultation, medical. It's not confirmatory, interprofessional, or telehealth, so we're going to click Other. We are going to go for the office outpatient medical decision making, and then straightforward. No pelvic examination was performed, so no, do not wish to code, and we get 99242 for the 20 minutes must be met or exceeded, medically straightforward examination. And then we're going to go for the CPT codes, which starts with the complete blood count and auto with auto, not whole blood. It is unspecified as to how the test was performed. And then we get 85025. And then we have another procedure that was performed, which is the sinus x-ray to rule out sinusitis. X-ray, and then I use spell site or type for sinus, paranasal, without contrast, 1 or 2 views, and then no more force, and then I get the code 70210, and I believe that completes that case. Moving on to case 7, we are given the ICD-10 diagnosis to code. Benign prostatic hypertrophy and cystitis. We're going to bring back our encoder, and we are going to go hyperplasia prostate, and we get the code N40.0. Cystitis codes to N30.90, and then we have the procedure, the cystoscopy, which moving into, we're going to continue out of here and we're going to do the next patient, and it is a male. The age isn't stated, so you enter in whatever age that you want. You add procedure and you do, I'm going to enter in, wait, hang on, let me double check, make sure I have the cystourethra. And then it is cystourethropy. And then no accompanying. We get the code 52000. And that completes case 7. Moving on to case 8. And this has several pieces. It utilizes ICD-10-CM, an evaluation and management code, and a couple of CPT codes. So we're going to start with ICD-10. We have, the first thing is diabetes. Diabetes type 2 with hyperglycemia, E11.65. We move into the lump in the breast. And in the unspecified quadrant, which gives us the code N63.10, J44.9. We then go into the chronic pulmonary disease, which in the documentation is stated as chronic small airway disease. And we get the complete code for J44.9. Moving down, we have obesity. It's no other information is stated here, so E66.9 is what we are going to use. Then we have the dependence on nicotine. Dependence on the drug, nicotine, cigarettes, to get the code F17.210. And then we have to mention the menopause as stated in the documentation. And we get the code Z78.0. We have noncompliance with medication. .19. Now, looking at the assignment, the Z91.19 was how the assignment was stated on the documentation, and I'm not sure. I want to say that it's Z91.199, but I am uncertain, and so I am going to keep on moving. Roll right past that into the neurogenic bladder. To get the code N31.9, we're going to move over to our encoder over here. We're going to continue. Next patient. We do have a female. I do not believe we are given any information as to age. And we are going to do the E&M code first. And it is stated as office visit, E&M. So let's see here. I'm going to go. I believe we are an established patient. Yeah. Medical decision making should be straightforward. No more. 212. Okay. So I got tied up. Let me think. Add procedure. We're going to do EM. We're going to do other. We're going to do outpatient. And then office outpatient of established. Nope. Established patient. Medical decision making. And then we're going to do low. And we do not have any prolonged staff time. No. And no more procedures. Do not wish to code. And then we get the correct code of 99213. I got tangled a little bit. So then we move on to the CPT codes, and it is a, let's see, lipid panel or the blood. Hemoglobin. So we're going to do blood test. And then we're going to do, I believe it's hemoglobin. Cancel out. Going to do 2. Blood count. And then we have the hemoglobin. 2. Other unspecified. To get the code 85018, I have it written down just to make sure that I get it set up okay in the camera. And then we're going to do laboratory test procedures, spell test not listed above. We're going to do a lipid panel. And then we have no more tests. It is unspecified as to how the specimen was gathered. And then we get the code of 80061. And then I'm going to hit continue just so I can hit next patient and have that ready to go. And I believe that that completes case 8. Case 9 also has the EM code. We're going to bring up our CM coder first. We are given the diagnosis to code here. This was trickier for me because the varix, and we're using varicose veins, and ulceration was a little bit tricky for me to get together and to understand, but I do think that I got there. Case 9. So we go varix leg with ulcerations on the calf, and we get I83.002. Documentation mentions edema, and mild edema was noted. So we're going just generalized, no other information necessary, R60.9. And then we are going to do the diabetes type 2 with diabetes 2 with hyperglycemia. And hyperglycemia, I'm pretty sure, is related to it comes from poor compliance. So poorly controlled, I think, is the link here. Poorly controlled would be hyperglycemia. To get the code E11.65. And we are going to go ahead and mail. I don't believe it states an age anywhere, so we just throw the age in. And we are going to add procedure. We're going to do EM evaluation management. I believe this is for it. So we're going to do inpatient. Hang on, let me find it. Office. Hang on. I always get so tied up. I get very, very tied up. I'm going to do EM evaluation. Other evaluation and services. Outpatient. Others specified. And then I think we are an established patient. Total medical decision making. Okay. And then straightforward. We don't have any prolonged time. We don't have any more information. Do not wish to code. And we do get the correct 99212 for the straightforward medical decision making. Now, I still get pretty tied up in the medical decision making process. I'm still finding my way around with that. But I think that that completes case 9. And I'm going to move on to case 10. And I'm going to continue out of here so I can do the next patient and start clear. Bring up the ICD-10 encoder. We have pilonidal cyst. The postoperative diagnosis is pilonidal cyst cellulitis. The operation is the pilonidal cystectomy, cyst tract exploration, and irrigation. So we use the 10 cm encoder for pilonidal infected, just straight up the top of the index, L05.91. We have cellulitis, and again, just off the top of the index, L03.90. And then we have let's get that a little bit further out of the way. I'm going to do, I believe it's male, and it does say the age 42, and the HCPCS CPT finder. And we are to do add procedure, cystectomy. We are going to do spell pilonidal cyst sinus, extensive for the code 11771, excision of pilonidal cyst or sinus extensive. And I think that completes case 10. Thank you very much.